Ladies and gentlemen, fellow Americans, once again, America finds itself standing on the edge of a familiar cliff. In Washington, the gears of government grind with tension, deadlines loom, and the word shutdown echoes across the media. But this time, the fight is not about a fence on the border, not about temporary tax credits, not even about general budget ceilings. No, this time, at the very heart of the standoff, lies one of the most personal, intimate, and vital issues in our national life: healthcare funding. This is not just another political quarrel. It is not a question that only concerns the halls of Congress or the headlines of the Washington Post. It is a question that touches the kitchen table of every American family. Because healthcare is not theory. It is not ideology. It is life. It is whether your newborn child can receive a checkup. It is whether your grandmother can afford insulin. It is whether the hospital in your town will still be open when you need it most. The ticking clock. The deadline is September 30th. That is the day government funding runs out unless Congress can pass a new budget. If no agreement is reached, much of the federal government shuts down. Hundreds of thousands of workers are furloughed without pay. National parks close. Passport applications freeze. Small business loans stop processing. Even food safety inspections slow down. We have seen these consequences before. But this time, the stakes are higher, because healthcare funding, the very money that sustains Medicaid, children's health insurance programs, subsidies for low-income families, and community health centers, is entangled in the fight. If the shutdown happens, it will not simply be a matter of government workers missing paychecks. It will mean real interruptions in healthcare delivery. And interruptions in healthcare are not inconveniences. They are emergencies. Why healthcare is different? The difference between healthcare and other budget categories is stark. If road maintenance funding is delayed, construction projects stop. That is frustrating. If agricultural subsidies are delayed, farmers suffer financial stress. That is serious. But if healthcare funding is delayed, lives are at stake. A missed chemotherapy session, a prescription that cannot be refilled, an ambulance service unsure if it will be reimbursed. These are not abstractions. They are mortal risks. Already, doctors' associations and hospital groups are warning of the consequences. Rural hospitals, many of which operate on thin margins and depend on federal reimbursements, could see cash flow disruptions within weeks. Community health centers, which serve more than 30 million Americans, including many in low-income urban areas, may be forced to cut services or reduce staff. Pregnant women who rely on Medicaid for prenatal care could lose access at the most vulnerable time in their lives. The economic cost. Beyond the direct human toll, the economic impact of a shutdown layered with healthcare disruption is staggering. During the 2018-2019 shutdown, economists estimate the U.S. lost about $11 billion, with roughly $3 billion permanently gone from the economy. Consumer confidence fell to its lowest point in years. Federal contractors went unpaid, and countless small businesses reliant on government activity lost revenue. Now imagine adding uncertainty about healthcare access to that equation. Families cutting back on spending because they fear medical bills. Seniors skipping medication because subsidies are delayed. Hospitals facing budget shortfalls, forced to lay off workers. Every dollar lost is not just a number. It is a lost job, a shuttered clinic, a family pushed deeper into debt. A history of shutdowns and healthcare battles. This is not the first time America has faced such a moment. History offers lessons, and those lessons are sobering. In 1995, under President Bill Clinton, the government shut down twice in a battle between a Democratic White House and a Republican-controlled Congress. At stake were budget priorities, including Medicare and public health funding. The result? Weeks of disruption and political backlash. In 2013, the fight revolved around President Obama's Affordable Care Act. Republicans in Congress refused to fund the government unless Obamacare was delayed or defunded. The government shut down for 16 days. Millions of Americans lived with uncertainty, and public opinion turned sharply against lawmakers seen as reckless. In 2018 to 2019, under President Donald Trump, the longest shutdown in U.S. history unfolded, 35 days. While that battle focused on border wall funding, healthcare programs suffered collateral damage. Native American healthcare services were disrupted. Nutrition programs for low-income families faced funding gaps. Clinics across the country cut back. Each shutdown left scars. Each proved that political gridlock has consequences measured not only in dollars, but in human well-being. The human face of the crisis. Let's bring this home. Behind every budget line is a face, a story, a family. Picture Maria, a single mother in Arizona, working 2 jobs to support her children. Her son has severe asthma. Medicaid covers his inhaler and regular checkups. Without funding, she cannot afford the medication. A simple cold could spiral into a life-threatening attack. Think of Robert and Linda, retirees in Pennsylvania. Both live on Social Security and modest pensions. Their prescription costs already eat up much of their monthly income. If subsidies lapse, they will have to decide whether to refill their heart medication or pay the heating bill, or consider a rural clinic in Nebraska. It serves thousands of people across miles of farmland. The clinic runs on federal reimbursements and grants. If the shutdown freezes those funds, it may close within weeks. For residents, the next nearest hospital is over an hour away. For a farmer having a heart attack, that hour could be the difference between life and death. These are not dramatic exaggerations. These are the real, foreseeable consequences of turning healthcare into a bargaining chip. Political positions. So why can't Congress agree? Democrats argue that healthcare is a right, not a privilege. They want to protect Medicaid, expand funding for community health centers, and ensure subsidies remain intact. To them, cutting health care during a time of economic uncertainty is immoral and unacceptable. Republicans counter that federal spending is ballooning out of control, and health care is one of the biggest drivers. They argue for stricter eligibility rules, caps on certain programs, and structural reforms to rein in costs. For them, this is not just about numbers. It is about preventing what they see as government overreach and runaway debt. The White House is under pressure from both sides. To compromise risks angering their own base. To hold firm risks triggering a shutdown that damages the economy and erodes trust in leadership. Trust in government. Every shutdown erodes public trust. Citizens ask, why can't our leaders do their jobs? Why should we pay taxes if basic services are held hostage? Poll after poll shows that public approval of Congress plummets during shutdown crises. In a democracy already strained by division and disinformation, this erosion of trust is dangerous. It fuels cynicism, apathy, and in some cases, extremism, a global perspective. It is worth remembering that America spends more on healthcare than any other country, about $4.5 trillion annually, nearly 18% of GDP. Yet outcomes like life expectancy and maternal mortality lag behind nations that spend far less. Countries such as Germany, France, and Canada have built systems that, while not perfect, ensure continuity of care without the constant threat of political shutdowns. They manage costs through negotiated drug prices, universal insurance coverage, and long-term planning. In America, by contrast, we allow political brinkmanship to endanger even the most basic functions of healthcare delivery. What message does that send to the world? That the richest nation on earth cannot guarantee medical stability for its own citizens? That we are willing to gamble with lives for the sake of partisan victories? The bigger question. This moment forces us to confront a bigger, deeper question. What kind of nation do we want to be? Do we want to be a country where healthcare is secure, stable, and protected, regardless of political winds? Or will we accept a future where families live in fear every fiscal year, wondering if their coverage will survive the latest standoff in Washington? Healthcare should never be a bargaining chip. Funding it should not depend on who wins a political chess match. Reform, efficiency, and accountability can and must be debated, but access to a doctor, a nurse, or a medicine cabinet cannot be held hostage. Closing words. As September 30th draws near, America once again holds its breath. Will Congress rise above partisanship and protect the people they were elected to serve? Or will we see another shutdown, another moment of dysfunction, another blow to trust in democracy? The truth is simple. America cannot afford a shutdown. Not now. Not over health care. Not when millions of lives and livelihoods are at stake. This is a test of leadership, of values, of compassion. If our leaders fail, it will not be them who suffer. It will be us. It will be the American people, the parents, the grandparents, the children. And we deserve better. Thank you.